Opioid overdoses are increasingly prevalent. Naloxone is a safe antidote that temporarily reverses the effects of an overdose. Using it saves lives. Naloxone is available at no charge for people aged 14 years and over at all pharmacies across Quebec and in some community organizations. No prescription is required. Consult your pharmacist. This video shows how to administer naloxone nasally when in the presence of a person that appears to be overdosing. How can you tell someone is overdosing? If it's possible that the affected individual has taken drugs or medication, they may be overdosing. A person experiencing an opioid overdose doesn't react to noise or touch, has difficulty breathing, sounds like snoring or has stopped breathing, has pinpoint pupils, may have bluish lips and nails, or cold, clammy skin. Does the person seem unconscious? First, remain calm. Try to get a reaction by shouting the person's name and speaking loudly, or by forcefully rubbing their sternum. If nothing happens, call 911 immediately or ask someone to do so. An overdose is a medical emergency. It's important to immediately call for help. Naloxone's action is temporary, and the effects of the overdose may reappear. Emergency medical technicians will administer the required care as soon as they arrive. How to administer naloxone via nasal spray. Remove the spray from its packaging. Don't test it. It only contains a single dose. Place the person on their back and tilt their head back. Gently insert the tip in a nostril. Using your thumb, firmly press down on the plunger. Remove the spray from the nostril. If the person remains unresponsive, perform chest compressions immediately. Perform 2 5 cm deep compressions every second, or perform CPR if you're trained to do so. If the person remains unresponsive 3 minutes after the initial dose, administer another dose in the other nostril using the second spray in the kit. You may administer an additional dose every 3 minutes if the person fails to regain consciousness and you happen to have several sprays on hand. If the person regains consciousness, while waiting for help, place the person on their side and remain nearby until the ambulance arrives, even if they have regained consciousness. Reassure the person and remind them to consult a health professional as soon as possible. Naloxone's effects are temporary, so the overdose's effects may reappear. If you have drugs in your possession, remember that the Good Samaritan law protects those who witness or are the victims of an overdose.